All right, so this is Sophia Lord, and she presents with a hip fracture, dementia, and a humeral fracture. As far as scientific reasoning, we want to use scientific reasoning to see how we should treat her. So we know that she has a posterior lateral approach, and the hip precautions for the posterior lateral approach are here in case you need a refresher. And for dementia, here's some information about dementia, including just general stuff, a duration, and symptoms, which could be important for Sophia, because we're trying to see if she has dementia or depression or a combination. And for her hip fracture, we know that average healing time is 6 to 8 weeks. And then we just have a schematic of what's going on in her bones, so we know to keep that in mind during the healing process.
So, Sophia Lord is an 80-year-old female in an acute care facility 1 day post-surgery for a total hip replacement. She presents with a right humeral fracture and early signs of dementia. She has a history of osteoporosis and osteoarthritis in her hips. She currently takes pain medications and does not report any allergies. Her daughter reports that Sophia has had difficulty coping with the death of her husband 6 months ago. Sophia describes reduced social participation, which she attributes to winter weather and difficulty getting about. Lives in the northeast of the United States. Prior to admittance, she lives alone in a Cape-style home with 3 steps in front, 2 steps in the garage, and 6 steps in the back. Her bedroom is on the second floor. Her roles include retired school teacher, widow, and mother. Her leisure activities include quilting, reading, and gardening. Her strengths include being cooperative and sociable during therapy. Her weaknesses include her emotional ability and being forgetful. Our main OT focus is going to be on her ability to adhere to hip precautions while engaging in meaningful daily activities and developing strategies to maintain her current independence. The therapist will first assess her environment, information, occupational performance, and executive functioning and mood. The therapist will choose assessments such as OPH2, MMT, range of motion, and the mini mental state exam based on observation and occupational performance evaluations. Sophia qualifies for Medicare. So you can find that here, and it will take you into the notes portion if you need a refresher of Sophia Lord's current occupational profile.
Okay, and so we've divided it up into each setting that she would be in. For the inpatient acute setting, her targeted occupational performance problem areas are listed here, and then we have stars on the side to tell you the main focus, the level of importance. So her early signs of dementia, we said to monitor, and that will be addressed in a later setting. For her right hip fracture, that's a primary importance in the inpatient acute care setting. We're going to focus on ADLs and her limited functional mobility due to her total hip replacement. Where also of secondary importance is her right humeral fracture, and that will also affect her ADLs.
So for her OT outcomes, we have a long-term goal and 3 short-term goals. So her long-term goal is that patient will perform ADLs, transfers, and dressing with modified independence while adhering to hip precautions. Our first short-term goal will be that patient will demonstrate sit-to-stand transfer independently while maintaining hip precautions. Our second goal is patient will demonstrate lower extremity dressing with use of adaptive equipment while maintaining hip precautions. And our third goal will be to participate in pendulum exercises of the glenohumeral joint for 10 minutes.
Okay. And as far as causes of problems, we have for performance skills and process skills, she needs to know how to use her hip kit because her dementia might affect her ability to learn how to use tools. And for social interaction skills, she's showing inappropriate expression of emotion. She's crying easily. And as far as motor skills, bending, lifting, and stabilizing are all hard for her. And she's having limited endurance associated with limited mobility before surgery, and it could be due to just being in the hospital for a while. As far as performance patterns, her routine, she has the morning and night routine, dressing and bathing, so they're disrupted. She's not going to do things the way she is used to doing them. And habits, we've got to keep in mind that Sophia might have some habits that cause her to not adhere to her hip precautions. For client factors, we have body functions. And as far as mental function, she has energy and drive problems because she's needing a lot of encouragement to walk during therapy, and she's getting very tired. As far as her memory, she's needing verbal cues to adhere to her hip precautions, and she's had difficulty learning, like we said above. Emotional, still she's crying. She's easily crying and sleep. She's having difficulty sleeping. Sensory function, she has pain due to her total hip replacement and a humeral fracture. Body structures, so we're like the structures of her nervous system are compromised due to her dementia, and structures related to movement, her hip and arm. As far as activity demands, we got to keep in mind the space demands, the required body functions and the required body structures, context and environment, her physical environment. We're just keeping that in mind in the acute care setting. It's good to know what she's going to be returning to.
So for the intervention approach, we used modified compensation adaptation. We're going to use the adaptive equipment due to her total hip replacement and modify the way she gets dressed and performs daily activities due to her current sling for her humeral fracture. The frame of reference we used was the biomechanical. This is mainly because Sophia needs to increase her strength, endurance, and range of motion. So we're mainly focusing on her body right now. For the intervention activities, we are going to use education and training. Education is mainly in the acute. We just want to make sure that she's aware of her hip precautions. And for training, we're going to do some pendulum exercises and the use of hip kit. So for the service delivery, OT is the best in the acute care, and it's going to be done at the hospital room 2 days post-surgery, and it will be done 30 minutes a day, 3 times a week. So now we're going to move to the subacute rehab nursing setting. So the targeted occupational performance problem areas here are going to be dementia, hip fracture, and humeral fracture. So here we're mainly going to focus on the hip fracture to make sure that she's doing her daily activities. Mainly her functional mobility is going to be impacted, so we want to focus on that. Then we're going to focus on the dementia, and it's causing some disturbance in sleep, so we want to address that. And we're going to monitor her humeral fracture, so that mainly might be affecting her upper extremity dressing.
As far as her goals, for the long-term goal, patient will safely perform ADLs independently and using adaptive equipment as needed. Her first short-term goal would be to reach for her clothes in her closet, demonstrating right shoulder flexion to 120 degrees without compensation within 1 week. She's going to need to have that skill when she goes home and is just reaching in her closet. For her second short-term goal, she will perform a morning routine while using energy conservation strategies with verbal cues from her caregiver. And thirdly, the patient and caregiver will demonstrate knowledge of 3 ways to improve sleep hygiene, like avoiding discussing emotionally charged topics before bed and using earplugs and eye masks. We're just going to want to establish a good sleep routine for her when she goes home.
So for the causes of problem, in the performance skills, her process skills, social interaction skills, and motor skills are affected. For process skills, we have the searches and locates due to her poor short-term memory and difficulty heeding the task of walking. She only walks short distances with encouragement. Her social interaction skills, she displays inappropriate expression of emotion. That might be due to her dementia. She tends to cry easily, as seen in the acute care setting. And her motor skills, she has difficulty enduring physical activity, and that may be due to fatigue. For her performance patterns, her routine may be affected, especially morning and night routine, such as dressing and bathing, is disrupted due to now having those really strict hip precautions, and her habits also might be affected, and that's also due to the hip precautions. The client factors, we have body functions and body structures that would be affected. For body functions, we have a specific mental function. The higher level cognitive is because she has difficulty processing information, and global mental function might be affected, the orientation part, because it was stated that orientation fluctuates throughout the day for Sophia. So her body structures, mainly structures of the nervous system due to dementia, and structures related to movement due to all the fractures that she currently has. For the activity demands, when she returns home, what might be affected is her required body functions, and objects used in their properties are currently now, we have to monitor that. For the context and environment, her physical is that, as seen previously in the acute care, her home has 3 steps at the front of the house and 6 steps of a deck at the back, and two-step access from her garage. Bedroom on the 2nd floor also, it might be an issue.
So as far as intervention approaches, we would like to restore her upper extremity and lower extremity function and modify her sleep routine. For frame of references, we're using the task-oriented approach in this setting to achieve recovery by using familiar objects within a natural context and environment, because Sophia stated that she wishes to return home because she would feel less confused in her familiar environment. Intervention activities are again going to include education, but now we're assuming she's gotten her hip kit down pretty well, so we're educating her on proper sleep hygiene and on energy conservation techniques. And for her occupations, she will complete morning dressing and hygiene routines using adaptive equipment. So just making that adaptive equipment part of her daily life for a while. And the OT, Audrey, will provide occupational therapy in a subacute rehab or skilled nursing setting, morning and afternoon, 2 hours a day, 5 times a week for 3 weeks.
So now we're going to move to the home setting. And right now we're going to mainly focus on her dementia. So that's going to be looking at her ADLs, her functioning mobility. She has a tendency to rush, so we're going to look at that. Social participation as well. Her social participation is low, and look at her IADLs. Mainly driving and community mobility is affected due to early signs of dementia and strict hip precautions. So then we're going to focus on her hip fracture, mainly her ADLs, functional ability, and safety during transfers. And we're going to monitor that humeral fracture, make sure it's healed, and look at her dressing, personal hygiene, and grooming, how she's doing in that, as well as her home establishment and management, and meal preparation and cleanup. Her long-term goal will be patient and caregiver will establish a daily routine while adhering to hip precautions. Her short-term goal will be patient and caregiver will establish a morning and night routine using physical cues such as a checklist and set up a ritual, maybe put a basket of supplies on the counter. Patient and caregiver will make appropriate home modifications as established by the occupational therapist using the SAFER assessment. And patient will perform range of motion exercises, 3 sets of 10 repetitions with physical cues.
Okay. And as far as causes of problems, we again have process skills, pacing and walking, because she's inclined to rush and she's lacking that awareness that she needs to recognize potentially unsafe situations. For performance patterns, we are trying to get her to do a new routine, so that will take her some time to get used to. For client factors, we have body functions and body structures. So for body functions, specific mental functions, we're concerned with her higher level cognitive functioning because she has difficulty processing information, and her global mental functions, again, her orientation is fluctuating throughout the day, and her body structures, the nervous system is damaged, and structures related to movement are also impaired right now. Activity demands, we're looking at her social demands, her sequencing and timing, the required actions and performance skills, and required body functions. As far as her context, we're changing her physical environment just a little bit to make her more safe, and also we're going to put tangible reminders of, we're not going to put, so being home can be a tangible reminder of how sad she is because of the death of her husband, but it could also be comforting to her to have all her stuff. So we're going to keep that in mind. And as far as personal context, the disruption of her usual routine may negatively affect Sophia's sense of control. So we're going to want to include her in that process as much as we can.
So for the intervention approach, we used remediation, and for that we're going to do range of motion and endurance, develop a structured routine to decrease confusion, and modify the home environment to increase safe mobility throughout the home. For the frame of reference, we used biomechanical, that's mainly to enhance occupational performance by increasing strength, endurance, and range of motion, and the quadraphonic approach to remediate or compensate for abilities in body function, cognitive, perceptual, and motor abilities. So this really kind of addresses Sophia's issues to be able to participate in occupations. For the intervention activities, for the occupations, patient will complete morning and night routines by using a checklist. For education, receive education regarding home and activity modifications to support maximum independence, and preparatory methods and tasks. Patient will do endurance, range of motion, and strength exercises using an exercise band. In the home setting, we're going to have OT Linda perform the delivery, and it's going to be at the home setting, and she will come to Sophia's home in the mornings for 1 hour a day, 1 time a week for around 3 months. And that's it for our case for Sophia Lord. Hope you guys enjoyed it, and have a great day.